Hello, my name is Ian, and I'm the office manager for Dr. Molly Kallenbach and Thrive Chiropractic. Today we're here with Chris Starkey, a patient of Dr. Molly's. She's going to be telling you a little bit about her story. Thanks, Chris, for taking some time to meet with us today. Chris, you and your husband, Mike, you guys have a somewhat unique professional background. Do you mind telling folks about that?
Oh, no problem. My husband is a radiologist. He's a doctor, a medical doctor, and I am a pediatric nurse practitioner. So our background is that of the medical model being not prevention, but cure. So treat the disease when it comes, treat it as best that you can, and wait for the next one and hope that you can conquer the first one that you're treating.
Okay, you hit on a little bit there, but as a medical professional, what was your perspective of chiropractic prior to coming to see Dr. Molly?
I have to admit, and I'm ashamed at this point to admit this, but it's true. I, being from the medical model, really I thought chiropractic was a little bit Looney Tunes, kind of silly stuff. I didn't think it really worked. I honestly didn't know anything about it. I went on the opinions of other medical professionals that I was around. I didn't ever experience it for myself. Of course, now my view is quite different.
To get your view different, why did you see Dr. Molly in the first place? Tell us that story.
I fell in 2007. I fell down my stairs, and I broke 2 of the bones in my back, the transverse processes of L1 and L2. And I was in agony. There was nothing they could do. I normally don't take any kind of pain meds. If I drink a glass of wine, I feel lightheaded. Even on the maximum dose of pain medication, I could not get relief. And the medical community could not do anything for me. It was the type of fracture that you don't do surgery for, you don't have a brace for, it's just rest and heal for 3 months. And I was just in absolute agony. It was the most painful thing to get up from the bed to go to the restroom. I've been through labor twice, and it was way worse than labor. Dr. Molly actually came to my house. I knew her as a friend first at a women's Bible study, and she came to my house with the activator, and oh my gosh, I had so much tension in my neck from the fracture in the lower part of my back. She used the activator on my neck only, and it melted the tension away. I got sleep for the first time in weeks.
Yeah.
It was very relieving. And right then and there, I knew that I was wrong about my assumption about chiropractic.
Sure. So what type of shape do you think you'd be in right now if you had not seen Dr. Molly?
I would probably be the equivalent of an 86-year-old woman at this point. I'm sure that I would not have full functioning of my back muscles. I would not be able to lift my children, and I would not be able to stand up for any length of time to do the regular household activities of daily living. But I can now. So.
Sounds like it's been a long journey. What advice would you give to a new patient considering seeing Dr. Molly?
I would say definitely see Dr. Molly. She has made a huge difference in my quality of life, and she's also really changed my view on health and vitality. Not only did she help me when I hurt my back, she helped me when I broke my leg. So Dr. Molly can help all different parts of your body, and right now I'm undergoing treatment through Dr. Molly for my thyroid condition. So. And everything I've tried so far that Dr. Molly has recommended has really made a difference. So I would highly recommend Dr. Molly.
So this hits a little bit on the same thing. What advice would you give to someone who may be considering Dr. Molly, but they're skeptical of chiropractic and a little concerned, or even sometimes folks are scared and fearful and that sort of thing?
Yeah. Well, you know what? I'm the right person to ask, because I was very biased against chiropractic at first. And I was in the worst pain of my life with my back fracture. And Dr. Molly laid hands on me with that activator and took care of me. There was no pain at all. In fact, there was relief of pain. And then slowly but surely, as my back healed, she was able to go lower with the treatment down the back, and completely took away my pain once my fracture was healed. I had leftover muscle spasms, and the medical community could not help me, but Dr. Molly could. So I would say, try it. Don't be afraid. There's really not pain involved. It's relief.